CBT, Cognitive Behavioral Therapy, the ultimate guide to overcome anxiety in relationships, depression, phobias, panic, and other mental health issues, using CBT and self-discipline. Written by Jason Brown. Narrated by Casey Wayman. Chapter 1. Depression. 1. Clinical features of depressive disorder. Depression is part of mood disorders and can take different forms depending on the frequency and intensity of the symptoms in terms of impact on the life of the subject. In the presence of individual transient events, it takes the form of a depressive episode, while it is defined as a depressive disorder in the event of an increase in the frequency of individual episodes. If the symptomology presents a certain level of intensity with respect to a compromise in the quality of the life or social adaptation, the diagnosis may indicate a real major depressive disorder. As indicated in the Diagnostic and Statistical Manual of Mental Disorders, DSM-4-TR, the major depressive episode must be characterized by symptoms lasting at least 2 weeks with an impact such as to determine a significant impairment of the social and work functioning of the subject. The main symptoms are psychomotor, agitation, and slowing down almost every day, fatigue or lack of energy, depressed mood for most of the day, almost every day, marked decrease in interest in all or almost all activities, which normally constitute a source of pleasure, for most of the day, every day, weight loss, insomnia, feelings of self-devaluation, recurrent thoughts of death. The prevailing feelings are sadness, confusion, fear, guilt, shame, feelings of inadequacy. From an etiological point of view, the causes of depression can be many, and despite the fact that depressive episodes can be favored by contingent events and situations, there would be a predisposition attributable to genetic and hereditary factors. In fact, it seems that subjects who have had relatives diagnosed with a major depressive disorder have a higher risk of running the same disorder. It is possible to argue that the depressive symptoms derive in some way from expectations of uncontrollability on the part of the subject. The latter, in fact, in the moment in which he is in conditions of uncontrollability, tends to formulate attributions of causal character on the events, and just when he hypothesizes for negative events occurred internal causes, he tends to develop a depressive symptomology. This is characterized by a low consideration of self, ideas of deprivation, self-criticism, and self-proof. Feelings of
Sample complete. Ready to continue?